As part of a health check at the veterinary clinic, a cat will have its ears examined. A vet will look for any signs of parasites, injury, infection and disease. It is therefore a good idea to practice, at home, the type of handling a vet will use to make sure the cat is fully comfortable with it. This will allow you to be able to check basic ear health at home, but also to help make this type of handling more familiar so the cat is able to cope with it at the veterinary clinic. Such handling involves checking the outside fur-lined part of the ears and checking the inside of the ears. To do this effectively, the flap of the ear may need to be folded back, so it is important a cat is fully comfortable with this. Associating handling ears with rewards, such as food treats, gentle stroking, or other things a cat likes, will help the cat to perceive the handling as positive. Sometimes the behaviour that we wish to reward, in this case being relaxed while the ears are being touched, can happen momentarily, particularly in early stages of training. Thus, by the time we provide the reward, the cat is doing something else and may not associate the reward with accepting the handling. A cat will learn best if the handling occurs first and then the reward follows. Here the reward is stroking and the marker word, which is linked to the reward, is yes.
Yes.
A small overlap between handling and reward is fine initially, as long as the handling always occurs first. Using this method, the cat learns that the handling predicts a reward, and thus the handling may become rewarding in its own right, as here where the cat is purring. Here a clicker is used. First, the clicker is associated with the reward, food in this case. This can be achieved by simply making the sound and providing a reward immediately afterwards. Repeating this pairing of a word or sound with the reward over several times will teach your cat that the word or sound predicts a reward is on its way. When the cat has learnt the word or sound and linked it to a reward, you will see it turn to you or show anticipation. So the word or sound lets the cat know that the behaviour it was performing was what we desired and a reward is on its way. Handling should always remain within the boundaries of what a cat is comfortable with. Thus, handling should start with the simplest and most tolerated form. Work slowly and progressively towards areas of the ear or movements that a cat may find more difficult to tolerate, stopping between short bouts of handling to offer rewards for remaining relaxed and still. This young kitten is learning to remain calm and relaxed while having its ears examined. Gentle stroking on the head is used as a reward. How quickly handling progresses depends very much on the individual cat, so always be guided by the cat's body language and how comfortable it appears to be. If at any stage a cat struggles or appears uncomfortable in any manner, the handling should stop immediately and the cat given a break. This kitten is not yet fully comfortable having his ear flap folded back, as seen by his slight wriggling and lifting of the paw. Handling goes back to gentle stroking until he fully relaxes again. When handling recommences once the cat is relaxed again, always go back a few stages and make handling easier than it was last time. This could be simply by touching an area of the ear you know the cat enjoys and working up from there and then getting to the more difficult to tolerate areas. Touching these areas for shorter periods so that the cat doesn't become uncomfortable again. Cats may also need medication placed in their ears. Once cats are fully comfortable having their ears touched and examined, the next step is to make sure that they are fully comfortable with the medication vessel approaching and touching the inside of their ear. Then you can progress to touching the ear with the vessel. You can practice this at home with any vessel that is similar to a medication vessel, always keeping the top on, gently touching it against the ear, removing and rewarding. Practicing this and ensuring the cat is fully comfortable with it will mean that when the cat does actually need medication, the only sensation that will be new will be the feeling of medication entering the ear. It is important never to put any liquid or ointment in a cat's ears. This should only ever be done when advised by a veterinarian. However, a cat will be much more equipped to cope with medication on or in the ear if it is already comfortably tolerating all handling steps that come before this sensation.